Welcome to the Pain Reduction Report by Ed Kane, and welcome to the functional therapy movement. In this short paper, we will introduce some amazing new progress in the non-surgical and drug-free treatment of pain. These are exciting times, and if you are reading this, you are going to be one of the few people who could be moving comfortably through your whole life. A brief disclaimer. The methods in this paper are provided to help you find different ways of relieving pain. They may not work for everyone. In fact, I've worked with many people who did not respond to these approaches. That said, I've worked with many more who have experienced significant and surprising reductions in their pain level. I offer this as educational material and not medical advice. If you have any concerns, you should seek the advice of a medical professional. If you are in a fragile medical state or have any concerns, please consult with a physician before attempting the approaches in this document. But let's start, and we can see if this can help you with getting you out of pain. By the end of this paper, if you follow along and do as I suggest, you should notice a remarkable reduction in pain. A life of comfortable movement. Throughout history, the idea that we will be in more pain and moving less comfortably through our lives has been a common assumption. It has been assumed that if you live long enough, you will likely be using a cane or a walker and be somewhat disabled. It's my hope that by reading this paper and doing the things that it says, that this will not be you. I'm going to share with you some of the many insights into pain management that I've learned in my many years as an occupational therapist and a registered functional therapist. Now, I'm in my 20th year as a treating therapist, and in the decades of training and practice with real people who are suffering, I have learned that we have been victim to a subtle lie. Have you ever heard someone say, "No pain, no gain"? I believe it is a lie that has been taking us down the wrong path for generations. First of all, it's kind of ridiculous on its face. No pain, no gain? Did that mean we could never gain anything without pain? Ridiculous. Think of something that you have achieved, even in sport. Does hitting a baseball hurt? Does scoring a basket? Does sinking a putt? Do all of these require pain in order to get better at them? No, of course not. For instance, you can even improve your jump shot by doing the task mentally. No pain required. Now, what is true about the lie? It is true that you may sometimes push through some discomfort and fatigue, and it will help you to discover your strength and endurance. It is true that you may sometimes push too hard or push into some extreme discomfort, and overall you will continue to progress. But the statement was, no pain, no gain. It's patently false in most of the time we train for sport. In fact, there are times when this old adage has been invoked as people did actual harm to themselves. My wife still suffers from knee injuries she sustained throwing shot put. If, when the first knee pain started, she had had some analysis and coaching, or some therapy, she could have prevented these injuries and probably been able to throw farther. Pain doesn't have anything to do with excellence in movement. The pain of injury is clearly different from the discomfort of high-performance sport. But we don't have a nice rhyme for, you can't achieve the highest performance without a little discomfort. This is probably what the original rhymers were getting at. It's okay to push yourself to the edge of your tolerance. But what about pain? Sometimes we may get injured. We may strain a muscle, strain a joint, sprain a joint, tear a ligament, or injure a tendon. Stuff happens, and whether it is from an accident or even overtraining, injuries can happen. When you are recovering from an injury, it would be appropriate to consider it from a different angle. And consider this different adage. I also conveniently wrote it so it would rhyme. Consider this: less pain, more gain. If you get injured, I want you to see a therapist or a care team who believes that you can make more gains with less overall pain. Now, is no pain realistic? Eventually, yes, but maybe not immediately. You might be open to some discomfort if the goal was less pain, more strength, and more motion for the ability to do more functioning. The therapist and the care team that is bringing you closer to more freedom and comfortable functioning should be working to get you there.